So I'm here with my wife, Jeanette Kruger, who has Lyme disease. Jeanette, just tell us how you got Lyme.
I was doing an overnight walk, an endurance walk that I have done before on the North Yorkshire Moors, and it's 40 miles that you do overnight. And somewhere along that walk, I must have been bitten by a tick that carried the Borrelia bacteria.
And how did you know you had Lyme?
I didn't actually. About 3 weeks after the walk, I started with stomach flu symptoms. A few months later, with flu symptoms, and again in a few months after that. After that, the doctor then diagnosed me with stress, eventually post-viral fatigue syndrome, depression, chronic fatigue syndrome, because of the severe tiredness that then started, and it was really an extreme kind of tiredness. So I wasn't any the wiser for a number of years, for about 2.5 years, that it may be anything more the matter than just the chronic fatigue syndrome.
So Lyme's actually quite easy to treat, isn't it? But the problem with you is that it wasn't diagnosed, so it took hold.
If it's detected early, then treatment is actually quite relatively simple and easy.
Just a simple course of antibiotics.
Yeah, between ideally 4 weeks, but between 2 and 4 weeks is sufficient to treat the bacteria. It's when it doesn't get treated that the Borrelia then starts to compromise the immune system and take over and allow other bacteria to actually come out. Borrelia is also known as the great imposter, and it mimics other diseases, which is one of the reasons why, if it's late diagnosis, makes it so hard to diagnose and or treat.
And this is what happened. Doctors kept thinking you had other things wrong with you. So what did they think was wrong with you?
Well, because of the chronic fatigue, and it was honestly, the fatigue was most probably my biggest symptom. The doctor diagnosed me with chronic fatigue syndrome, and decided that it was most probably related to depression. I did say to him that I was worried about the fact that I went from an extremely active person, I've run the London Marathon twice. I've completed this walk twice.
Which is a 42 miles.
Which is a 42 miles through the night walk. And ended up in bed and couldn't get out of bed anymore.
So what was it like at its worst? How did you feel?
Well, my brain stopped working. I think that was the biggest symptom of them all, is that after about a year and a half, my brain just stopped functioning. I couldn't do spreadsheets. I couldn't read emails. I didn't recognize words, so I couldn't read anymore. I used to do a lot of puzzles and word puzzles and number puzzles. I just couldn't cope with that. My brain I would look at it and would have no idea what to do with it.
I think I noticed that you couldn't follow TV programmes, and you would then only watch TV programmes that had familiar characters in. So the same.
That's
programs.
True. There was some element of the familiarity of the characters, and I most probably sort of know the format that the program took rather than what was really happening. My brain retention just became nil. I couldn't retain any information.
And you stopped thinking I was funny, which I think for me was probably the most troubling symptom.
That was most probably very hard for you to cope with, and I'm really sorry about that.
No, that's okay. I'm just glad that I was being funny. You just didn't appreciate it.
I didn't appreciate it, but that is what happens when the bacteria crosses the blood-brain barrier. The brain just stops registering.
So how did you hit upon Lyme as a diagnosis? I remember one day you just went to the internet and you just found this thing and you said, look, this is it. This is what I've got.
Well, I became very knowledgeable about chronic fatigue syndrome. I knew everything about the supplements that will help me, the things that I needed to do that will help me. And we were watching TV one night, and my face, I suddenly started to suffer from facial paralysis. And it was when that happened that I thought, this is a weird symptom and a new symptom. And I frantically started Googling, because it was the most scary. I think other than the brain fog, that was most probably the second most scary symptom that I've experienced, because the inside of my eyes and my mouth went numb. And the one thing that kept on popping up with this various symptoms was Lyme disease. And when I saw that and I looked at the list, I realized that's what I had. And when I then looked at the timeline, I could trace it back to the walk that I've done in June 2010. Because it was 3 weeks after that I became ill for the first time.
So then you went to South Africa, saw a Lyme specialist, Dr. Cecile Jadin, and followed the protocol. And what has been your treatment then over the last 18 months?
So I saw her in February last year, and she did a very advanced test. So where here you would have the normal blood tests and my cholesterol showed up high and my iron showed up low, she then goes beyond that and will test for all sorts of bacterial infections and a variety of more advanced tests. When the tests and when she saw my iron and my cholesterol test, she immediately said that it's bacterial related. Those are two things that are often affected by bacterial infections. So when we got the test back, she diagnosed me with multiple bacterial infections. And it turned out that apart from and it was all brought on by the Borrelia, the untreated Borrelia.
So the Borrelia was from the tick bite.
From the tick bite.
And this all caused Lyme disease. And then you're very deficient in iron, so that would make you feel tired. But one of the things that you've been prescribed was iron supplements. Which was actually feeding the bacteria.
It was feeding the bacteria, so it became a bit of a catch-22. The other thing that happened was that it was not only Borrelia now anymore, because Borrelia then will open the door for other dormant infections to come to the surface. And that's what started to happen.
So what sort of things are they?
So I had other tick bite related infections that I most probably picked up many years ago in South Africa, which are rickettsial related. And if people are familiar with African tick bite fever, that's a rickettsial versus Lyme being a spirochete. And
so you've now been going 18 months or so on
so I've been on
antibiotics.
I've been on treatment since March last year. I'm on daily treatment basically, so it works in 4-week cycles. 1 week of combined antibiotics, and then 3 weeks being on quinine sulfate, or Nivaquin is the brand name.
And these are different antibiotics each month in different pairings?
Different antibiotics each month. They both bactericidal and bacteriostatic, and so what that means is that the bacteriostatic antibiotic will stop, it won't kill the bacteria, but it will stop the bacteria from multiplying and growing. The bactericidal antibiotics will kill the bacteria. So you use a combination of those. And the reason for that is especially because Borrelia it's also called a shapeshifter. It will change form from one to the other so that it can survive.
So antibiotics is the way to treat it. If anyone listening to this thinks they might have Lyme, what should they do to, first of all, get it tested for, and then what other things they can do already before they see a doctor?
Well, there's several things that they can do. There's many herbal solutions as well, but I think so from what I've seen and from what I've experienced, antibiotics definitely seems to be the way to treat it, at least until such time that you can get on top of the bacteria load. The most important thing is if you have been bitten and you then have the bullseye rash, which is literally looking like a bullseye with a red dot in the middle, white around it, red around that ring anywhere on your body, that becomes a fairly simple diagnosis, because you can go to your doctor and say, here is the evidence that I've been bitten, and a simple course of antibiotics can sort that out. When it's become more long term and you're experiencing all these symptoms, the chances are that you will need to get the tests done and then need to find a treatment protocol. Now, there's not many doctors. I mean, there's not, as far as I know, a treatment protocol available in the UK, and it's also difficult because it's not a one-size-fits-all. So there are doctors in the UK that do treat their patients. You can contact the Lyme Disease Action to find out if they have any recommendations for you. In America, there are several Lyme literate doctors. And then there's the option of seeing Dr. Yadin in South Africa, who has a very substantial treatment protocol, but also backed up by a support protocol.
And you also do a blog, don't you?
Yes, I do. When I started to become better, I thought I should be doing things again. And so I started writing a blog. It's called A Run, a Walk and a Tick Bite Later. And it's on my website called JeanetteKruger.com. And I'm writing, I've told my story and I'm sharing my experience, because I would like to think that if somebody reads that, at least it creates some form of an awareness, and I think that's what we lack most of all at the moment.
And in recent days we've heard John Caudwell, the billionaire, has Lyme disease, and so do all members of his family. Do you think that's going to raise awareness?
Yes, he has posted on his Facebook page, and I as I suspected at the time, he got completely inundated with messages from people. I think people were so relieved to actually have somebody who has the clout that we don't have as a voice, and was able to get the message out there for us. So he has posted, and he's literally been doing this for about 2 weeks. In his family, both his first wife, his 2 daughters and his son, and himself has been diagnosed with Lyme disease, of which his son are the most ill, and it sounds like it's the brain fog. So where the Lyme crosses the blood-brain barrier, that is causing most of the symptoms and problems. But yes, he has said that he will be lobbying in Parliament and on the health services. So it's wonderful to have somebody with that kind of clout to get out there and actually take the message out and get the awareness. The other thing that he has said that he will do is that he wants for doctors to be at least a number of doctors to be trained awareness and where people can go. And then the further thing was the testing. It's the testing that is so difficult to get properly done in the UK. He has also said that he will look at starting a charity or some kind of an initiative around this, to help creating awareness and to get the testing more accessible for people. But he is quite right by saying that it's the medical profession that needs to pick this up and actually take ownership and recognise that this is a problem, and that it's a serious problem.
Okay, last thing, how are you feeling now?
Well, I've since November last year, I suddenly started to leave home again. I was housebound for about 3 years from January 2002. I had to stop driving at some point, and was
to 2012.
2012, sorry.
Yeah.
Yes, January 2012, and I was mainly in bed, most probably for the better part of 2 years of that, where I couldn't. My body was just too sore and too tired. So I had to spend a lot of time in bed, and I spent a lot of time sleeping or staying awake. Your whole cycle gets disrupted by this. But since November, it is as if the treatment just suddenly started to kick in, and every month I can feel myself getting a little bit stronger and a little bit better. I've started to work again in August this year, only a few hours a day and only 2 days a week. But the big thing is that I have started working again, and we look to that will most probably become back to full time in the new year. If anybody would be interested, I also have a Facebook page. It's called A Run, a Walk and a Tick Bite Later, and then of course my blog, where I share my experiences.
And the blog address is JeanetteKruger.com.
.com.
Thank you very much.
Thank you.